Hello, everyone. Welcome to today's virtual conversation, brought to you by the Making the Shift in Conversation series. Making the Shift is a youth homelessness social innovation lab that funds, conducts, prototypes, and mobilizes cutting-edge research to prevent and end youth homelessness in Canada. MTS is funded by the Government of Canada's Networks of Centres of Excellence program. Visit our website at makingtheshift.ca for more info. Our hashtag for today's event is MTS in Convo, and we'll be retweeting content from that conversation. You can follow us at the Homeless Hub. This is a listen-in only webinar, so if you have questions for the panelists, please type them into the question box in the control panel on your screen. We'll host a Q&A in the second half of the webinar. We have also enabled closed captioning, which you will also see in the control panel on your screen. You can follow along with live notes if you click on Custom Live Streaming Service at the top left corner of your screen. If you experience any technical issues, send us a message through the questions box. We'll be recording today's webinar and you'll receive a follow-up email with the link. Before we begin, it is our custom in Canadian universities to acknowledge the land on which we work, study, and live. Since this meeting is being held online, a singular land acknowledgement does not capture the richness of our distribution across many locations in Canada and around the world. There are few places on earth that someone before us has not called home. As Making the Shift is hosted at York University in Toronto, we would like to share the land acknowledgement that is used at York University, and we invite all guests who are joining us today to consider their own position with regard to the land where they find themselves. Making the Shift acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Tikarondo has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. Now we're going to hand it over to the moderator of this webinar, Matt Parker from HelpSeeker, to introduce our guest today. Thank you, everyone, and enjoy the talk.
Thanks, Meryl. Matt Parker, pronouns he, him, his. Very happy to be here today. My background is a PhD MBA. Best way to explain myself is just a huge nerd for innovation. So I've worked across a few industries now, healthcare, public, private sector, and now I'm working at HelpSeeker as a VP of Innovation. And so we're really focused on how do we transform the social sector, both from a systems perspective, but also technological perspective, which is more where I focus. So to start off with, I really want to introduce kind of why we're here today. So data is such a key piece, I'd say, of innovation, but also of doing more with less. And it's something we're often confronted with in any industry, but especially in the social sector. More people need help today than ever before. So how do we make sure we do the most with what we have? And if we look at the media, we see all this information about how much data there is. If you search data explosion, you'll get 15 different figures about how much data there is. We personally generated a ton of data, but data on its own is kind of useless. I know I've pulled from a variety of data sets that people don't use, which is especially endemic in healthcare, where in Canada we collect so much health data, but use so little of it. But with that, if we have usable data, if we have accessible data, if we have data that's actually been curated and monitored, it becomes so powerful to make a distinct change in our industry or in our society as a whole. Now, one really important aspect of this is privacy, security, and equity. And that's going to be a theme in our talk today. But the one thing I caution is, and I'm going to steal someone else's words here because I can't do it justice, but there's a group of Canadian radiologists who described it as a spectrum. On one side, we have privacy, we have that security aspect, and that's often where we focus so heavily. But on the other side of the spectrum, we have altruism. What we can do with this data to help society, and especially in this sector, some of the people who really need our help most. So as we go through this, I'm really excited about our panelists today, because we're going to talk about not only data, but what we can do in the sector, some really actionable insights from some of the leading minds in our industry today. So now that we've kind of talked about why we're here, I'd like to introduce our panelists. So to start with Michael Lenczner, if you could just say hi and introduce yourself.
Hi, everyone. Happy to be here. Thanks very much, Matt. I'm the CEO of a company called Aja, and there's a nonprofit initiative that we started called Powered by Data that exists on the Make Way platform, which used to be called Tides Canada. And I guess, yeah, I'm looking forward to the conversation, Matt.
Thanks, Michael. And Robyn Blackadar.
Yes, good morning, everyone. And thank you very much for the land acknowledgement. I'm Robyn Blackadar. I'm the President CEO of PolicyWise for Children and Families, and I am meeting with you today on Treaty 6 territory, which has been extremely cold these past 10 days. And I want to express my gratitude and respect for those of you who've been working hard to ensure that those people who are experiencing homelessness and poverty are protected and supported at this time. And I do apologize if the cold front is coming out east, because it's really nice today. It's -6. So made it through that. My background, I'm honored as well to be a member of the data team, or the community member of the data team for the Making the Shift Social Innovation Youth Homelessness Platform. I'm also very involved in Alberta as a leader of the Alberta Nonprofit Network, as well as co-chairing the Alberta Nonprofit Data Strategy. Really finding ourselves as an organization experienced in many aspects of data, administrative data. That's the main thing I know that I'm here to support and supply some experience with, but also have had lots of experience with capacity building in the nonprofit sector, and a lot of what we end up with that and what we need, guidelines, frameworks, and privacy protecting software. We've had some very good experience with that. So I look forward to wading in. We're a very unique, I guess, nonprofit that has been able to develop quantitative and qualitative research methodologies outside of a university setting, being able to collaborate very closely with researchers in academia, collaborate with policy analysts and community organizations to do the work that we do to fulfill our mandate for well-being and resiliency of families, youth, children, and communities.
Thanks, Robyn. So Michael will be starting off with the presentation here. Really excited to see it. So what we'll do is Michael will give his presentation. We'll have a quick discussion as the panelists, and then we'll open it up to Q&A. So really would like this to be kind of more the ongoing discussion with a lot of back and forth. But as mentioned, if you could just pop your questions into the chat, we'll try to get to what we can. But I'll now pass it off to Michael just so he can dive into his presentation.
Okay, thanks, Matt. Yes. And I guess I'm going to see that on there. We go, sharing screen. So yeah, Powered by Data has been working with MTS. I'll show the next slide, but sorry, what we're talking about today is how data can be used under the MTS, the Making the Shift theme of moving towards prevention. And so we're talking today about how can we leverage data in that changing context, and what do we need to think about in that. So we can go to the next slide, thanks. I don't know, yeah. So just to situate us, both, in terms of the project and in terms of why I'm here with Powered by Data, we've been working with Making the Shift around the theme about data and technology. But you see there's 5 themes for Making the Shift. So again, Making the Shift is about moving towards prevention for youth homelessness. And there's 5 themes, and the theme about leveraging data and technology is what we're helping with to help with the call for proposals and designing that, working with MTS to design that funding. So that's the work we've been doing, and the call for proposals is out and that has passed. We'll share the link to that later on, but that's over. And yeah, we'll go to the next slide, please. So just to, some different basic concepts in here. I know a lot of you know this stuff already, but how we think about these questions of research and data is that research methodology, data assets, and research questions all need to go together. If you change one, you need to change the other one, so they're interrelated. That's all to understand those three things gets connected. The next slide, please. This is Power by Data's, our basic theory of change. Is that if you look at the blue there, if you want evidence-based decisions, you need research and analytical tools, which require data infrastructure, which require enabling policies and legislation. And if those things happen, you get evidence-based decisions, or it's easier to make evidence-based decisions, which in turn drives more of a need for policies, legislation, and data infrastructure. So we look at the bottom two parts as enabling the top two parts. And we find that not a lot of people focus on the bottom two parts, and we're very happy to play that role, especially in the nonprofit sector. So go to the next slide, please. So just different ideas that we're going to reference, both maybe hear it in the conversation later, is the shift from managing homelessness. I'm not trying to say that pejoratively, but there's a difference in dealing with a crisis and addressing, managing homeless. I think you can maybe find a better word for that, but this idea of shifting from dealing with the situation with preventing the situation is one thing, and how do we have data systems that allow for that or enable that? Another concept is just that HIFIS is a shelter management system here in Canada, and it's widely used, but not universally used. And then this idea of administrative data. Administrative data is data collected by the government, mainly by the government, in the courses of administering their programs and services. So when the government knows gender, knows sex, I think, for people because it's asked for in the driver's licenses. And so that information is collected by government and kept somewhere in government. If we want to be able to access that information, we would be accessing administrative data. Another concept is just people that are signed up for different, that access different government programs. Those names are collected, and that information is collected. And obviously that's, there's ethical concerns with using that information, but there's also lots of opportunities to use that information or benefits from using that information. So administrative data is different than kind of case data. And it's usually has a larger population, or sometimes an entire population in it. So we'll be discussing about administrative data a bit today. Go to the next slide, please. So data infrastructure, the point is that there's actually pipes somewhere. It's not about the physicalness of data infrastructure, but it's that there's a reality to it, and it works one way and not another, and they can be very difficult to change. So just to ground us, and in this, there's a reality to these systems that needs to be addressed. Go to the next slide, please. This is a great definition that I like for data infrastructure in a book that came out a few years ago. When we're talking about data infrastructure, it's the systems that do it, but it's also the systems that govern those systems. So how are identifiers managed? How is funding managed for infrastructure? What are the policies? How are those policies managed? And the different people that are part of using and funding and feeding that data infrastructure should all be understood. So go to the next slide, please. So when we're thinking and working with MTS to think about how can we best leverage data or use data in order to prevent homelessness, or to understand how we could prevent homelessness. There's a lot of choices that need to be made, and there's not always clear right answers for those choices. But I have 3 questions here that are design questions that you need to address when figuring out how to leverage data. So there's options, and people need to be informed into which option to choose. And so one question is that people need to face is, do we expand shelter case management systems in order to collect additional information? Or do we instead seek to leverage that data by connecting with identifying external data sources and connecting HIFA's data or case management's data with those external data sources. So there's no right answer for that. It would depend on the use case, what you're trying to figure out. But that is a design question. We'll go to the next one. If you do want to connect HIFA's data to or shelter management data to population data, to administrative data, I'm sorry, there's lots of options for how to do that. In Canada, obviously, we have provincial governments and federal governments, and lucky for us, they all are working on different ways to collect and manage and leverage their administrative data. So, we have the Canadian Research Data Center Network, that the RDCs that are set up and exist at each research university in Canada. I think there's 30 of them. They're a StatsCan funded program, or StatsCan and the Tri-Council, and administrative data is you're able to use it through that. CIHI is a federal program to collect health data. It's often a lot of billing data that the provinces share at a national level. ISIS is a program at the Ontario provincial level to collect healthcare data, and I believe it's not just more granular, but there's actually case information in it that you can access at the provincial level that maybe doesn't exist at the level of detail at the national level of CIHI. And then Ontario is one of the 3 provinces in the last 3 years that have changed its legislation to explicitly allow the use of administrative data by government, because bureaucrats were a bit fuzzy on whether that was permitted or not. So 3 provinces have stepped forward in the last 2 years to clarify that that is something that they are want to be doing. And so Ontario is setting up these interministerial data integration units, and you have to kind of dig to find out what they're up to, but they're a very new thing, and you could leverage them as well. So we have a new slide, please. And a third question is, if we're focusing on prevention, we need to understand what people are up to before they become, before they enter into homelessness, before they become homeless. And if you wanted to, make sure that people are exiting, you want to know what people are doing after to some degree. So again, it's an oversimplification, but you can think about that you're working from, managing beds to tracking individuals. And that's a big change, or that could be a big change. So how do you, if you're doing that and you're leveraging these additional data sources, how do you change the governance of ethics? How does risk change? And how can you involve people in making those changes for themselves, or representatively making those changes, or being involved in those? So we'll go to the next slide. So those are 3 of the questions that I have opinions on, and we encounter these again and again in our work. And Matt has experience and a perspective on this, and Robyn has more experience than I do doing this work. I'm so excited to discuss this as a group and with all of you. We were very we're thrilled to be able to collaborate with Making the Shift for this call for proposals. And if you're interested in just some of these ideas, you might be able to find more in that call for proposals that might be of interest. And I think that's us being done for this, Matt, and happy to kind of go to discussion. But is there a next slide, or is that it? That's it.
Thanks, Michael. That was a great presentation. Really, this topic is so important. For those who haven't worked directly with data, it is a huge task to create these pipelines on your own, even if you're just looking at, let's say, StatsCan data. To get actual insight out of it, it is such a challenge. We're completing a machine learning and AI project at HelpSeeker at the end of the month. And you'd think the high technology piece, the machine learning, would be the focus, but we, looking back, spent 70% of our time on this project matching data sets, working with data sets, data entering, that back end, because it's such a task just to even say, if I have a data set from StatsCan and I have a data set from my municipality, those aren't apples to apples comparison. So this is why these pipelines are so vital. If we want to democratize access and democratize insights more, we need to make the data more accessible and not just kind of the bailiwick of specialists. So to start with, Robyn, I just want to get your thoughts here on what Michael talked about and any insights you can offer.
Yeah, for sure. No, I appreciate Michael's presentation. Michael and I have gone back many years on being, I guess, champions of access, improved access to data sets that are already there. Maddie, that is truly, I think you put it out there that there's so much data that could be analyzed, could be understood. But then there's obviously the rules around, well, just because it can be, should it be? I mean, there's a lot of issues around privacy and the legislation that's put in place, very much so that it isn't seen as being data that's available for whoever and whenever for us to dive into it. So I think that exactly balance. I appreciate, Michael, that you put the balance between what we need to know to really use the data to improve decisions and what we really need to ensure that we don't do to compromise confidentiality, privacy, ethics, and respect for the people there are people behind all of those data elements. So we in PolicyWise have had some wonderful experience with an administrative data set, linking data from multiple ministries. That it took, I think, 2 years to be able to create the data set, which was called the Child and Youth Data Lab. A lot of work went into, as you say, the pipeline of getting the data, cleaning the data, linking it, anonymizing it, putting the reports out, and unfortunately, it no longer exists. It does exist, we hope, somewhere within government, but it doesn't belong to us anymore. So we went through quite a bit of experience with there's a lot to do, a lot of work to do as well with deleting all the data that you have when you've finished research projects. Unfortunate that it stayed as a research project. Having said that, I feel very strongly about the need for questions and research questions and reasons for analyzing data. That's certainly a learning that we had. The comment I could make as well about the Making the Shift call for proposals around the data infrastructure is we were very glad to see that there was a focus on creating a roadmap. It's amazing, and we've been involved in so many subsector or larger initiatives around data, and this one particular for sure is about people experiencing homelessness and youth in particular. But there's so much to learn, even if you and so much work to do to just even concentrate on that, what you might call subsector. So we were glad and gratified to see that there was a roadmap. We in Alberta are working on a roadmap for Alberta nonprofit data strategy. Some planning needs to go into this, some coordination. I am positive that people that are on the line today have also got initiatives and data work underway. And the more that we can learn from each other and collaborate, the better to be able to plan for that infrastructure and those changes and the barriers, reducing those and doing things in an ethical way.
Thanks, Robyn. That was great. So there's some great questions coming in. If you see me looking over, I'm just monitoring them on my screen here. But before we get into the audience questions, I think one really important topic would be great to discuss is kind of the ethical aspect of this. Because a lot has been made about, can we predict homelessness? Can we kind of get ahead of the crisis of, let's say, addiction that's come as a result of the pandemic? So I want to ask the question of, what are some of the ethical considerations the panel thinks we need to address with this data being used, especially with, like I said, pandemic has changed the game for the social sector. Things are moving rapidly. So how do we deal with this in an ethical and unbiased manner? So maybe we'll start with Michael and then move on to Robyn.
Oh, I was like, Robyn's done this work as opposed to me who talks about doing this work. I was hoping Robyn would go first.
Michael, if you like, I mean,
Great.
There's a difference in, so we learned a lot through the administrative data work that we did, and we sort of took for granted that because we had the data, we could just do whatever we wanted with the data. And I remember being at a presentation where someone, I know it was from the Alberta First Nations Information Governance Center, asked the question and said, were we familiar with OCAP principles? And I thought, no, I'm not. And through that, and that was very early on in our journey, we became more knowledgeable about ownership of data, especially data collected on and about and from Indigenous communities. There was so much learning. At the highest level with administrative data, though, having said that, we trusted that that data was collected within the parameters, you know, the ethical parameters, because by the time it goes into the system, what we're doing is secondary analysis. It's hard for us to know, even though we are part of, I guess, what we decided as well was we wouldn't release any data or any results without ensuring that we had gone through conversations with the groups and individuals and anonymized it and ensured that there was nothing that was being shared that could, you know, re-identify someone. So that's at that level. We felt that there was a little bit more rules in place, health information legislation here in Alberta, which really is very, very strict around, you know, linking and sharing data. What we did though just recently at the ground and at the community level, at that collection, and I think that's one of the questions I found in the chat is about how are we ensuring we understand what clients are feeling and what service providers are feeling about collection of data. We were very lucky to have been asked to work with a group called Home and Health in Calgary, which represents about 30 nonprofit sector organizations who were really asking that very question. Just because the legislation says you can share data and collect data about people, should you? So what are the ethics behind that? And so we were able to develop what we're calling an ethical information sharing collection tool. And we worked with an elder who included the 7 grandfather principles into the tool. We're very grateful for that being a co-created tool, which would, you know, ensure, and I think we found about, there's 7 dimensions. We'd love to share that at some point. There's not enough time right now, but this is at the ground. So this is where I think for those of us that are working high up in the administrative data world, we could feel a little bit more reassured around how that data was collected at the outset. And so that by the time it comes into, and what you would work with, Matt, as well, and perhaps Michael, is that big data sets that at that time you're really not thinking about collection, you're really thinking about analysis. And so there's some trust that needs to go along there with that. But at some point we would be very happy to provide a webinar and share. I know that this project sponsor has said to us that we can share the work that we've done with the ethical decision making tool that we've done. And this was for only for, at this point, the homelessness community, or the communities that were serving people experiencing homelessness with complex health needs, which is a whole other very important element. People with mental health issues and other health conditions, and the need for privacy and support and reduced stigma. I could probably go on and on. I'll be quiet.
No, thanks, Robyn. That's amazing. And I think some really important things to highlight. OCAP is a great framework of how to, you know, look at some of the underlying biases, especially with colonization, that whole bag of worms. Bias does live in our data and in all our data, so it's something we need to take account for. And it's a great point, Robyn, that once we get to analysis, it's almost too late. But that being said, we need to be careful of understanding what the underlying bias is and what it means to make a wrong decision out of our data. And you made a lot of great comparisons to healthcare. And having kind of worked with the framework of the ethics, regulatory approval within healthcare of using data, they have a great framework of kind of 2 axes. Of one is, how is your data being used, or why? So who are you going to help? What's the benefit? So if we're just monitoring a population, there's no benefit to society. But if we're going to save lives, that's really important. The other thing is the population you're dealing with. So in healthcare, you know, if you're dealing with someone very frail and elderly, or a pediatric patient, that's dealt with differently than someone who's, you know, in their 30s, healthy, no health problems. And so I think this is what is so important, is looking at this lens of not only how do we understand the bias inherent in our data and apply best class principles like OCAP or the systems Robyn's talking about, but also what it means if we're wrong with the data is so important. I think that can't be diminished, and the risk to society. Michael, do you want to add anything into this, or?
Yeah, I guess 2 thoughts. Maybe I don't know how many thoughts about ethics. So in terms of using this data, there are absolutely additional risks that enter the situation. And although administrative data, I think as a practice, I think there's good use of good protection of the data in general from what I've seen, but it's the application of the data where you can really go, where I've seen more focus on things going badly. So, simplistic answers to social problems are never are always something to be wary of. So I've been inspired by, I think homelessness is one of the areas where there's more of a focus than other areas in social services on the involvement of people with lived experience, and not just involvement, but that there's power that goes along with those roles and responsibilities that go along with those roles. I'd love to see more of that in other social sectors, and trying to think about where are beneficiaries being involved in order to make decisions around stuff. And with administrative data, it's easy to have a distance from the data, and so having people in with lived experience, I think that's where you get the benefit of that, is saying, all right, does this even make sense? Does this, ground checking this? So that's something to think about it. But I guess the other parts around ethics and administrative data is, what I see is that these linkages aren't happening because people don't care. That administrative data linking happens in areas where it's a priority for society. And so they do lots of it in healthcare. Why? Partially because because healthcare affects everyone, including the middle and upper class people. But the other reason is that healthcare takes up like 30 to 40% of our budget at the provincial level. So governments are very focused on how do they manage healthcare costs, and they're linking a lot of healthcare data. I don't see that happening in foster care. There's not the same level of focus and interest from different partners about these things. So there's, I think, an ethics question about what does it mean to not avail ourselves of these opportunities, not because there's we can eliminate the problem tomorrow, or eliminate some of these difficulties tomorrow, but because we need to reflect on what does it mean if we're not using practices that other people are using in other spaces. What does it mean about homelessness?
No, that's great. Thank you, Michael. So one question that's been asked in the chat here is accessing, especially administrative data, can be quite a challenge, especially if you're not embedded in the system. So what are kind of the obstacles, tips, and resources individuals can use to get better access to these more restricted data sets? Open to the panelists here, whoever wants to start.
I'll jump in on that.
First,
yeah, again, Robyn's got lots of experience doing this, and in the story of the child youth and data lab, is a great example. But there's kind of a situation with admin data is, either you have the data, in which case you work for government, or hospitals or these very close to government, or you're on the outside and you want to access this, but you don't own it, and you're asking for access. So I think it's important to understand that governments are struggling to make use of this resource themselves, and they're working on it pretty hard. It's not, in my understanding, it's the people that think about how government works. This is one of their things that they care about and are spending energy on. But that's happening at every province and at the federal government. I'm not sure if there's a lot of shared conversations about how to make this work happen. So in Powered by Data, we created a coalition of people to talk about, coalition of service providers to inform ourselves on this and to direct engagement on policy. So at Powered by Data, you can see there's a data policy coalition that really focuses on these questions about how do we access administrative data, and should we, and under what considerations. So it's not like government's just holding it and deciding whether or not they should share it with people. They're actively trying to make use of it themselves and harness it themselves. If you look at the social data linkage environment, the SDLE that StatsCan has, it's not that expensive. You can request, if you have data, you want to link it to data that StatsCan has, and StatsCan is collecting data from all the provinces. So it's pulling in educational data and justice data are two priorities I know that they're getting from the provinces, locating at StatsCan. And you're able to ask StatsCan to link those data sets, and I think it costs like $6,000 for the first linkage, just to let you know whether that's possible or not. And then there's some smaller fees for accessing those at the research data centers. So it's, it's obviously that's not any person can do that at $6,000, but it's also not the most expensive thing. So I think it's as much a question of if the data assets are available, something like StatsCan, it's a question of, and people know about it and normalizing that use, and doing scholarship and working with specific data sets to figure out how to be able to reliably pull insights from them. And for areas where those information aren't available through these mechanisms, it's raising consciousness and saying to the government, we really need these data sets, please put them in a place where we can access them. And Robyn, over to you.
No, I think I agree with you. I absolutely agree that the government themselves, and this is all levels, whether it's federal, provincial, or municipal, have got very strong internal data initiatives where they themselves seeing the value and they want to be able to use their data. I think part of that then is there's the capacity to do your own thing, but as well respond to requests, say, from researchers who are applying for, in our case, you can apply quite and probably most best within the health ministries and Alberta Health Services, for example. They've got a very culture of I think it's called data liberation, the lead there, who's very interested in that. And so that is going on. And StatsCan has been very helpful for us with the Alberta Nonprofit Data Strategy, accessing the charities data. They themselves are going through a capacity issue as well of just not having enough people there to help themselves and us with all of our requests. And then I think the one thing you didn't mention, Michael, that might come up again is the open data initiatives, where we have found, though, through that, there are hundreds of data sets on there, aggregate data more so, but at least it's data that many organizations have no idea that it's there. And even when they do know it's there, they don't really know what to do with it. So one of the things that we had worked on through the Alberta Nonprofit Data Strategy was encouraging some training, some modules, some support to organizations around, I think we identified there was something like 600 data sets that would have been helpful for the nonprofit sector if they knew they were there and if they knew what to do with them. So that as well is something that could be done and to support access to existing data sets.
Great, thanks, Robyn and Michael. So another question related to this has come up of how do individual organizations gain access and really leverage some of this data when you have limited funding, you may not have the skill sets and really informed decision making. So I can start here and then open it up to the panel. I know that's something at HelpSeeker we found a challenge because we can do a bit of economies of scale because we have more of a data team, people who access this data. But I think there's two separate problems here. One is how do I even just get the data, access it, organize it, look at it? But then the second kind of issue here is really the so what. If I see that socioeconomic indicators are getting worse, what does that mean to homelessness? Kind of how can I use it? So this is a challenge, and I think with decision making, it's been brought up a few times that we need to be careful with how we make these conclusions, assumptions, what have you. And I don't think there's a great answer today. There's some easier data sets to access, like StatsCan has been brought up a few times, that have easier to use API, easy to pull it down. Things like census is much harder to use consistently and get good insights because it changes every 5 years. Where I see it going really is how do we use technology to help enable this? So one area we're looking into heavily is what's called decision support systems. So how do you look at kind of a bit of dashboarding to show the most pertinent information? So not looking at 100 economic indicators, but let's say you're looking at homelessness. What has the strongest correlation of economic indicators to homelessness? But then also the insight. So based on the research, based on best practices, what does this data suggest? And so I don't think there's a great answer, and I'll open this up to the panelists, but technology seems to be the way in which we can get better information and insights out to the community at large. So Robyn or Michael, love to get your thoughts here.
So me to go, Michael. I think, yeah, agree. This is definitely a challenge. And I think that what we've been able to do with organizations who are asking those questions about wanting to have access to more data, or even doing some research around what data is already there and helping, and in doing interpretation, is that we've actually been kind of like an intermediary. We need more organizations to help be that go-between. We can't expect many organizations or any organization that's out there providing frontline service to then hire a whole team of data analytic guys, data scientists who are, in demand by Google and places where they're going to get a lot more, salary support and even access to researchers. So I think that the idea, and for us, and we found this as well with School of Public Policy at U of C, some of the collaborative initiatives where we have universities, researchers, sometimes private partners who want to support actually the purchase of technology, and then groups like ours who are helping with developing the guidelines and understanding interpretation and context, for example, working together as a team to be able to support organizations. And also I would encourage organizations to work with each other, to join together and put in perhaps even proposals that say, like, we need to have support to do projects and initiatives, and if we pool our funding, pool our expertise, we may very well be more successful than if we try to just do this on our own. So that's kind of been many of our experiences of, we could probably name at least 8 to 10 little projects that were funded, say, from a foundation who encouraged us to work with a university, who helped us access data, say through community data, StatsCan's organized, place where they provide data at the community level, and then come together with a product that at the end of the day is based on an understanding of what to do with the data as well. And so yeah, lots of good examples about that we could share, but I'll turn it over to you, Michael.
Yeah, Matt, I think about how HelpSeeker is a systems level solution. It's HelpSeeker. What I understand you guys are doing, it's not solely about working with individual organizations in order to leverage their data only within their organization so that they can answer all the questions they need. And Robyn, you're talking about collective, work and having intermediaries. We have this notion that nonprofits can do evidence-based decision-making with the data within their walls. And I don't know why we think that. I don't think that we collect enough information. And even if we collected all the possible information on the people that we interact with, or people that I don't work in this sector, and the people that came through your doors, you're not talking to people that aren't coming through your doors. So how would you know? Lots of questions depend on being able to tell differences between people and between populations. So I don't know why we have this idea of being able to do things, finding answers on our own with our own data. And I think I haven't heard good explanations for why that's the case. And I think we should really question that. So hopefully that's the kind of thinking that we're contributing to. The other example we're using, we're talking about how can you build a sewer system on your own? It's like, well, you can't. These are certain things like infrastructure often are collective solutions. So what nonprofits can do is think about how can I leverage the existing infrastructure, because there is the infrastructure that exists outside of your organization. How can you leverage that now? How can you participate in projects that are leveraging that infrastructure and contribute to those discussions, because there's need for different people to be part of those sewer building conversations and sewer maintenance conversations. And I think that's a valued expertise when people start framing it that way.
Thanks, Michael. Great question too. I think this is such an important discussion to have, so I'm really glad we're getting diverse opinions and chatting this through a bit. So another question that's come up is, to what degree does strict data sharing rules water down or deform or obscure the realities in data? Short answer is it does, and we need to be careful. And this is where I think access, Michael brought up a really good point of access at an individual organization. This is quite hard because it's a big crunchy question. I'll use the example of anonymization. In Canada, depending on the province you go to and even the organization you work with, they have different rules, restrictions, and regulations or understandings of how to anonymize data. It's all, let's say in healthcare under the Health Information Act, I've worked with this before. I can ask two different people within a government organization that can give me two different answers. So there is watering down occurring. And I think that's something we need to be careful of and make sure we understand kind of what's occurred to get us this aggregate data. And it's, I think Robyn brought this up before, because some jurisdictions like US has their own problems, but they have what's called safe harbor, where they very specifically itemize in anonymization in the aggregation process what changes. And so you can get uniformity there, but I think is in the Canadian context, we do not have that. So it is a very important point we need to be careful of. So Robyn and Michael, love to get your thoughts here.
Michael.
Sorry, so I was listening to your thoughts, Matt, but maybe could you repeat the question again?
Yeah, I kind of was going to ask that too. I missed the question a bit. Sorry about that.
So the question is about
what you were talking about.
Oh, no, fair enough. The strict data sharing rules are kind of with this anonymization, with this kind of aggregation, the data we get access to, do we lose insights because it's either, it sounds like it's either not gotten out far enough, or to get access to it, we lose some of that granularity?
So again, I leave that more to Robyn, that you've done this before. My understanding is not that the major problem is that people are using these data sets in a Canadian context to make ungrounded claims. I don't think there's a question of losing, like that absolutely could happen. And I think, you know, talking about the rules of you know, community university collaboration, which I think the homeless sector does, the homelessness prevention sector does really well compared to other sectors. There's, you know, the MTS is a great example, but it's not a unique example of collaboration. So I think that's a real risk, but I think again, it's a misunderstanding of the actual risks. The risks are that the main, not the risk, but as a whole, I'd say this isn't happening really in the sector. So again, I'm loath to address the question of harm to people that come from using this data, as opposed to the existing harm that comes from people not using these practices. And again, I don't understand. I don't see people having an informed sense of, I'm not using these specific practices because of the risks involved. There's just people are not aware of these opportunities, and to some extent, even researchers within homelessness are not aware of these opportunities. In the field of homelessness research as a whole needs to say, where are we on this, and are we happy with where we are in terms of our ability to leverage quantitative data and population data sets? So because this is a new topic, I think we really need to keep that in mind of not just locating the risks that come first to mind to us, even though those are very real and very important risks, but to really go beyond that and say, well, you know, what are the risks that no one cares about exploring these? And again, why are we not using this when this is normal practice in other fields? Is it because of ethical concerns, which is a great reason, or is it because of other things, like such as our lack of funding or a lack of prioritization from different, you know, other partners in Canadian society?
And the only thing I could add to that is I just remember, certainly we went through this because if you recall, we were linking non-health with health data, which was definitely a no-no unless it was you know, anonymized. I remember we had the legal team saying that they wanted to assure that there was zero risk of re-identification by linking that data. And I remember us all saying, that's actually impossible. I mean that, you know, by the time you put all these different elements together, and if you strip out so many of the variables, then what do you end up with in terms of being able to understand anything from the data? So there was a lot of balancing going back and forth, but I remember that and I think they're still out there, and I'm not the expert here, but some technology that supported different levels of anonymization and associated that with risk. And what risk were you willing to take? Whether, you know, you would take that likely, obviously, as we would have done when we had to go through an ethics review and, you know, work with our privacy commissioner. And so there was some technology to support you with that. When it comes down to data sharing at the community level, though, this is another issue that's been going on for a long time, certainly within the realm of supporting people with experiencing homelessness because of their need to access so many different services, health, justice, community social services, all of those areas. And Alberta and other provinces have been working hard around, just as you say, Michael, saying we have to be able to, if we cannot share certain level of data around those individuals, how do we know how to best serve them? Are we missing things or some gaps in the service provision, or can we serve a person walks into a food bank and there's some understanding that the fact that that person is associated with a different program, can we just meet their needs right there, and instead of having them go to 4 or 5 other services? So that is definitely the case. I mean, certainly why you would want to have improved data sharing at that level. And obviously there's privacy and ethical issues there as well, but there's also technology and there's ways of going about doing that. And we've had some experience ourselves and others have as well with information sharing guidelines that were reassuring privacy and confidentiality.
I guess, sorry, Matt, to go back to just say about that. I know I didn't talk about the question, which is are there legislative barriers? Are there, what are the barriers to this data sharing happening? I'm just, so I've been in the nonprofit sector for 20 years, and my normal understanding of the nonprofit sector is we do pre versus post evaluations, which is, someone came in with these indicators and they left with these indicators. And, the paucity of what that can actually tell you in terms of an evaluation, but that's, not maybe less normalized in homelessness, but was normalized in the areas of the nonprofit sector that I was in. And then if you look at organizations like PolicyWise, but also like the Social Research and Demonstration Corporation, SDR, or Social Demonstration and Research Corporation, SDRC, or SRDC, I forget which one it is. I didn't know about them until I've been in the sector for 15 years. And I look at the work that they do, and they're just chock full of statisticians and epidemiologists and demographers. And they're the ones that government hires to do evaluations of social programs. And the average evaluation costs between $700,000 and $1.2 or $3 million. And you're like, all right, so when people really care and they're going to spend lots of money, this is how you do an evaluation. And then there's a group called Blueprint ADE that I think comes from that same group of people, and it now exists in Toronto and does some similar work to Robyn's shop. It really has hardcore expertise in administrative data use and these questions. And government hires them to do employment. There's a big employment thing they're working on. And so the barriers don't seem to exist when it's important. So I just can't get away from that, where it's like, maybe the barriers are a thing, but I think the political significance of these ideas and the talking about innovation, about do these new innovations, or it's government says we have all this data on you, and maybe they don't want to tell everyone about that, but then they leverage that data when it's important to them. So I'm stuck on that.
Oh, thank you. I think in summary, there are risks, but if we don't use it, how can we even assess the risks versus value? So great conversation here. So another question here is, can coordinated access, so I know a little bit about this, where a food bank talks to a homeless shelter and that kind of coordination, and intended data systems developed at the municipal level drive data use and innovation, and if so, how? So essentially, if organizations talk to each other, how can that help get more data out there and drive innovation? So I have a couple things to say, but I'll open up to the panel first.
Yeah.
So you've done some of this work, Robyn. We've talked to a lot of people that do local data sharing, but in general, we don't think that's the best, or that's the first option for people to do. Obviously, as Robyn was saying, when you want to share integrated service delivery, if you want to do integrated service delivery and you don't want the person to have to go give a case history at every single organization that can take 69 minutes to do a case history, you want to be able to share these in ways that work for people. but probably integrated service delivery is not where you're actually able to find out the impact of the services or of the research questions. Maybe it's much more operational data sharing so that you can do treatment, but probably you're going to be using population data or administrative data to be able to answer research questions, is what I would say. How does it drive innovation? I just think about if each nonprofit needed to share data with every other nonprofit next to them, you know, that would be a lot of lines in a graph. And that's not how other sectors do it. Education, the data is shared, is vertically kind of collected and then shared at the ministry level. Healthcare, it's vertically collected and then shared at the same level. So I'm not sure this best practice to be doing local sharing, but there's lots of examples where it does, where the use cases do require that. And Robyn's working on those, so shut up.
No, well, I guess our experience with local data sharing, if there's a couple of things, it depends on what you mean by that. If that means, you know, taking the organization's data and putting it all into one database and then being able to analyze that and be able to go forward, say, to a municipal group or government to say, look, the 5 of us or 6 of us have been working together. There's a lot of experience that we have about how is it even possible for those organizations who are collecting data in a different way. We attempted to work on, there is a group that has a shared service, an integrated service here in Edmonton, and they did approach us. They wanted to share their data. They were all bought in. Sometimes there's some issues around trusting, but we look at that data, we, not me, but our technical people would say, I don't think you actually can. You're going to have to come up with some common identifiers and some common ways of collecting that data. And so we've had some experience. We've worked with Carleton University, Common Approach, a SHIRT grant, and a couple other funders to create something called Build Better Data Project, where we're coming up with some standards for data collection with across nonprofit organizations so that they could even possibly share their data if we mean by putting it into a centralized system or being able to actually analyze that data. You can, the other way of course, as we've been, I'm sure organizations have been doing for years, of those that are listening that provide services, they have case management meetings where they're actually sharing information about clients, but not necessarily the data that was collected, the quantitative stuff that kind of goes into that. So that's one thing that came to mind. But I know, I also don't know if anybody's on the line, but say from Edmonton Police Services has really moved forward on social innovation labs, like the need for groups to get together, to collaborate, to integrate at least their thinking first and foremost before you even probably can think about integrating and sharing your data. That is going on. I think that's a very successful move forward, and I'm sure it's happening in other provinces to be able to then access and as municipal level data, provincial, federal, depending on what you need and you know who has it. But the last thing I was going to say too is that you will not, and I think you said this, Michael, get outcomes and outside from just purely administrative high level data without having an idea of the ground something that's based as well in research in terms of being able to the cause and effect. So that, we're all needed. As I'm talking, I'm trying not to use my hands, but I can see the community working with academia, with working with government, with working with technology intermediaries, pull that all together. Not an easy thing to do, absolutely, but there's pockets of that happening all over the place because people are just tired of waiting for, say, government to take a lead. They're just saying, no, we've got to do this. Let's move forward and bring it back to making the shift and really recognizing and respecting their leadership in moving forward on this.
Yeah, it's an important question. I know at HelpSeeker, we've delivered on integrated, we call it integrated coordinated access projects. So how do you get, even aside from the data, service providers to talk together, to coordinate, to refer one person to another? From diving into this deeper, the tools don't exist today. So we've talked about HIFIS, that's for the homeless sector. So if we want HIFIS to talk to a domestic violence charity, it doesn't right now. You need to take out the data from HIFIS analyze it, get data out of the other charity, which might be on Excel or paper or in a completely different format. And that's one of the big questions we're actually trying to ask at HelpSeeker and figure out how do we get the tools so we can even ask these questions? Because it's been brought up as 2, 3, 10, 15 organizations talking to each other. It doesn't work. We need tools and systems to actually coordinate and have this data kind of talk to each other, because one organization can't do it. It's got to be a community level initiative. And we need to find out ways in which there's not all the heavy lifting on the end user to coordinate this, which is such an important area. But I know we're coming up to time here. We got, about 6 or 7 minutes left. Maybe if we want to each just kind of go through with some concluding statements, anything we've learned or anything we really want to highlight or talk about before we close up here. Maybe I'll start with you, Michael.
I'm just really excited to have conversations where the homelessness sector is bringing and leaning on its whatever it's learned around involving people with lived experience and not being removed from from the work that happens. I think I think a lot of there's a lot of strength in the nonprofit sector that we are close to the problems that we're talking about. But anyway, bring that thrust with whatever it is that the epidemiologists and demographers are thinking about. So if I could if I could go to a dinner party, that'd be great at some point in time after COVID. But being able to sit with the demographer, with these population data scientists and learn from them and figure out what they're doing, I just think there's and that's already happening in this space. And there's people on the call, you can see people on this call that are already doing that work. But I still think there's more to be done there, and there's innovations to be had around what does that governance look like at different levels. And what is the governance of Stats Can that's required? The fact that these data linkages have to be approved by the chief statistician. It's nice on one hand that there's responsibility happening in those ways, but in the other way, we're still very new in learning how to deal with administrative data and the ethics of that. And I look forward to having a more mature, more robust ways of leveraging this stuff and learning about the ethical risks and learning about how to make it useful and not to do research that really doesn't help both service providers and the people that they're serving. So I think it's still early days, but it's an exciting time, I think. So yeah, so that's it.
Robyn, if you'd like to.
Yeah, I think I did a bit of a summary statement about all of the players and the actors that are involved here and need to be involved, and my only, I guess, a thing to think about, it isn't just about data. There's people behind the data. I really liked the focus on ethics and lived experience and context, and I do feel that with the sector that is supporting individuals experiencing homelessness and complex health needs, we already have a very strong group of individuals and organizations that are very much committed to doing whatever they can, data-driven, and most importantly, wisdom-driven. And I think that's something that we within my organization have come to terms with around how do we link our quantitative thinking with our qualitative. We have a thing called the data to wisdom cycle, and I really encourage us to continue to think in that way as we move forward. And I feel that we've got, with researchers, from my experience with making the shift and being involved with the discussion with researchers in this this community of practice, I guess we call ourselves, and being open to and having the courage to take on the data challenges at the same time as taking the actual real challenges of preventing homelessness is very, very wonderful and inspiring. I'm very happy to be part of it. And I hope that whatever I've been able to support or supply in terms of information and experience would be made available to anyone at any time.
Thanks, Robyn and Michael. I have to say, I've really enjoyed the panel, the conversation we've had today. And I'd like to end on a bit of a story. It's interesting. At one point in my career, I moved from working at a hospital group in Toronto to working more in the private sector. And I know it seems like we've talked a lot about complexity and how hard things are and how we could do more. But this is such an exciting conversation not to be looked at in any negative light, because I remember going from the hospital to working with an insurance company and thinking, oh crap, I'm finally out of the public sector. The data is going to be great. It's going to be so amazing, land of milk and honey. But in reality, we all struggle with data. It's a hard conversation. It's hard to get value out of it. This is not an easy task. So even though there are challenges, even though sometimes there are all these considerations, there's so much value to be unlocked. And it's so exciting that we're talking today about how we can help some of the people who most need help in Canada through data, through technology, through working together. So this panel, I think, is so important. The discussion, the work Making the Shift does, the work we all do on this line can really inform and help so many people. So to really just end on a very positive note, it's so exciting to me personally to be a part of this. And I think the fact that we can do so much with even just what we have today and what we can build moving forward. So thank you, Michael. Thank you, Robyn. It's been absolutely amazing to be on this panel. And thanks to Making the Shift for actually organizing all this. Always happy to nerd out about data, so happy to be here, and I'll pass it over to Making the Shift.
Thanks, Matt.
Thank you so much, everyone. This was such an interesting and informative discussion. I think people in the chat really responded well to the conversation. So we really appreciate your time. I and everyone at Making the Shift today are so grateful that you could make the time to join us. We will be sending the recording to everyone who was registered, and we'll also be sharing this on our social media, and also take a look at or keep an eye out for a blog post that we'll be sharing later from the panelists with more information and resources on our website. Today's event was the third of our In Conversation series. If you have any feedback on our event today, we'd love to hear from you in our post-event survey. We have just shared it in the webinar chat. If you'd like to learn more about Making the Shift, you can visit our website at makingtheshift.ca or subscribe to our newsletter. The link should be in the chat. If you have any questions for us or any of the panelists, you can also email us at makingtheshift@yorku.ca. And we'll say one final goodbye to our guests today. Thank you so much, Robyn, Matt, and Michael.
Thank you.
Thanks so much.